Hello, and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. In this month's episode, a local expert explains how specialized therapy helps patients quickly and safely resume home chores. We'll explain how a campaign to bring enhanced cardiac care to Lake County is already saving lives. And Tavares surgeons explain how a common and dangerous injury can now be treated with a minimally invasive procedure. Our first story focuses on a chronic condition that affects more than 37 million people. Chronic sinusitis can truly affect one's quality of life, yet many people choose to just put up with the discomfort. Now, a minimally invasive procedure available right here in Lake County can help people breathe easier. Sinusitis is caused by the swelling of nasal membranes. It can cause uncomfortable sinus pressure.
There are two main categories of sinus problems. There's the one person who may come in and say, "Doctor, I get 3 or 4 sinus infections a year, but I feel good in between." That would be more of a recurrent infection as opposed to a patient who comes in and says, "You know something, I seem to feel something most of the time. I'm always stuffy, I'm always feeling some sinus pressure, I always have some drainage problems," and that to me lends itself more to a chronic type of infection.
Dr. Friedman is the first physician in Lake County to have performed balloon sinuplasty, a relatively new procedure that provides relief.
It's essentially a balloon angioplasty of the sinuses. So whereas with traditional sinus surgery, we're removing tissue to create the openings into the sinuses, the balloon procedure does this without removing any tissue. So it's a minimally invasive, atraumatic procedure to remodel the openings of the sinuses by gently fracturing the bony openings to make them larger and wider so the sinuses function better. The nice thing about the procedure is there's no recovery time, there are no complications, we don't have to worry about scarring, we don't have to worry about bleeding, the patients can resume their normal activities the following day. We try to improve patients' drainage patterns so that the drainage is normal. Once the sinuses are ventilating properly and draining properly, the sinuses can function better.
After treating her sinus infection with antibiotics and not getting results, Dr. Friedman recommended Amy Blue of Fruitland Park have balloon sinuplasty surgery.
Prior to the surgery, I was having a really hard time sleeping. I would wake up a lot because my sinuses were so clogged. My husband hated to hear me snore. It was terrible. I couldn't smell or taste anything, and I would just constantly have a little dry cough. Immediately after, I really didn't have that much pain. I thought that I would, but I didn't. I was able to breathe in through my nose for the first time in a long time. I could smell a few things. I really couldn't taste yet, but that started to come back gradually.
Dr. Friedman says the procedure can be done in the doctor's office in most cases and is covered by insurance. Balloon sinuplasty may be an appropriate treatment for children and adults. Visit fhwaterman.com to identify a specialist who can help with sinus conditions. Next, we look at a common condition that can come about in an instant. If you're feeling discomfort in the groin area, it could be a hernia. If not repaired, a hernia can progress and lead to more health problems.
They do tend to occur more frequently or actually be symptomatic more frequently in men, but they can occur in women. The presentation of a hernia can be quite varied. An early phase of a hernia tends to be actually more painful, but less obvious in terms of what you can feel or you can see. Some people do have that classic presentation where they lift something heavy, they feel a pop in their groin, they take a look down there and there's a bulge and it hurts, and they go to their doctor, yes, they do have a hernia.
The hernia is a potential problem because it is a hole in the abdominal wall where your intestine can slip through, and when your intestine gets slipped through, it can get stuck, it can become what we call incarcerated, and if the intestine cannot be reduced back in, then over a certain amount of time, the intestine can undergo ischemia, where the blood supply is cut short, and we call that strangulation, and the bowel that is stuck in the hernia can die, and that becomes an emergency.
For most patients, treatment or repair of a hernia is done with minimally invasive surgery.
After a hernia surgery, I usually tell my patient that we ask that they do not perform any heavy liftings such as moving furniture or go bowling or play golf. for about 4 to 6 weeks. Certainly with laparoscopic procedure, we see that the patients often experience less pain. When it is a small incision, they have a less chance of having complication, and they can usually return to work earlier and return to normal life earlier.
If you suspect you have a hernia, you should see your physician immediately. Visit the hospital website to find a local doctor. Lake County residents are already enjoying the results of an important community initiative. In 2010, the Florida Hospital Waterman Foundation launched a campaign to raise more than $5 million to enhance cardiac care. Through the generosity of individuals, community businesses, and vendor partners, the campaign is now complete and has funded expansion of open heart surgery services. It also provided for upgrades to the hospital's catheterization and electrophysiology labs. Norma Taylor of Mount Dora, who is active in the hospital auxiliary, is now living without fear and discomfort after a procedure to help her arrhythmia, or irregular heartbeat.
You wake up with your heart just pounding away and you wonder what's happening. This not only in the middle of the night, because it would happen in the daytime. I would be here at the hospital volunteering, and all of a sudden my heart would be beating out of my chest. It was recommended that I see Dr. Bryce. And when I saw Dr. Bryce, he said that there was a very minor surgical procedure that would relieve that, and that I would not be waking up in the middle of the night with my heart pounding out of my chest and being very frightened by that.
When I joined Florida Hospital Waterman, it was only done around 60 pacemakers a year, and it was done by general surgeons. Otherwise, if any other complex cases, the patient needed to be transferred to Orlando. Now we have a truly minimally invasive, and we can really find out and diagnose an arrhythmia that sometimes is not significant, and we can reinforce that there's nothing to worry about it, but also we can detect an arrhythmia or a problem that potentially can have a life-threatening significance for that particular patient. And we create all this service line. It's tremendous because the patient just get the service right here, and a lot of these procedures are outpatient, so it's a lot easier for the patient to drive 10, 15, 30 minutes.
I was allowed to go home the next day, and I have not had any. I have AFib. They say it's still there. When Heather checks my pacemaker, the AFib is there, but I don't have the frightening beating of my heart that scared me so much. It's just a calmer effect. It is. It's real good. Yeah.
You can learn more about the extensive cardiac services available right here in Lake County by visiting fhwatermanheart.com. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. A visit to the Conry Creation Health Center kitchen offers a spring recipe that will satisfy the entire family. A Lake County expert explains how doctors enlist community resources to help patients manage multiple diseases. And how do patients safely resume normal activities at home after being in the hospital? Find out about specialized therapy. Visit watermanwellness.com for a complete listing of the specialists featured in this episode. And you can register to have Waterman Wellness magazine delivered to your home address. Now, Waterman Wellness has information about local health events you may want to put on your calendar. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Michelle Wargo. After an accident or serious surgery, it's not uncommon for recovering patients to need specialized help to resume independence. Often, a physician will order therapy for a patient that is designed to help him or her be able to function at home.
One of the things occupational therapy focuses on is, it's called occupation, because the work that you do in your home environment would be your occupation. So in the kitchen, if someone is trying to get a glass and it's on the second shelf and they cannot get up there without being at risk for falls, we want to work with moving those things to a lower shelf, and that's one of the things the therapist would do.
Coleman Brooks says occupational therapy also helps a patient adapt to a change in capabilities that may have resulted from the medical care.
Occupational therapy also focuses on energy conservation. So take rest periods and any type of new equipment that the patient might have. Occupational therapy usually is the one that goes in and teaches new equipment.
And it is not necessarily therapy that is reserved for the elderly. Coleman Brooks says occupational therapy can benefit younger patients who may seem strong and capable.
A lot of times when someone's been in for an elective surgery or an accident and it resulted in a surgery, when they come home on medications, a lot of times it puts them at risk because of the pain medications alone. And you know, just getting acquired to being safe after having procedures done, you know, the same area they used to be safe in before may not be as easy to acclimate on their own without having some added services.
You can learn more about Florida Hospital Waterman's home care services by calling 352-253-3900 or visit the website. It's not uncommon for members of our aging population to be diagnosed with multiple chronic illnesses, such as hypertension, cardiovascular disease, and diabetes. Managing these conditions while trying to maintain good health and independence can be complicated. Family practice doctor Veronica Chastain says enlisting your physician to coordinate your care is important.
In chronic illness management, we use evidence-based medicine. Basically, we use our expertise and coordinate the available resources to inform and educate our patients so they can take active part in their care and they can cope better with their condition. Lifestyle modification is of utmost importance for a diabetic patient. So being able to get them to a diabetic educator or a nutritionist can be as important as any medicine that we can prescribe.
Physicians may choose to enroll their diabetic patients into specialized programs.
There's different programs in the community, especially as to engage patients in exercise activity and diet modifications, even restrictions in terms of alcohol intake, smoking cessation, all of which combined have shown to decrease the risk for cardiovascular disease, which is our utmost goal.
The Conry Creation Health Center at Florida Hospital Waterman offers a diabetes education class each month. The 2-day course, led by a certified diabetes educator, provides everyday strategies for nutrition, exercise, and disease management. The course does require a physician referral, and you can learn more by visiting the Conry Creation Health Center website. It's spring, which means there will be an abundance of fresh fruits and vegetables available. We head to the Conry Creation Health Center kitchen now to learn how to put them together for a delicious, filling meal. Are you looking to add a little pizzazz to your salad? Well, why not try some fresh and dried fruits? So joining me today is Florida Hospital Waterman Executive Chef David Atkinson, and we have registered dietitian Stephanie Bassett here to share with us a spring salad that has a special ingredient.
Pears.
Pears. Now, why are pears good for us?
Pears are low in calories, good source of fiber, and a really good source of antioxidants as well.
Fantastic. So Dave, what else goes into this?
Well, we're going to start by making a dressing, a balsamic vinegar dressing with Dijon mustard, garlic, salt and pepper, balsamic vinegar, and extra virgin olive oil.
Okay.
And then we're going to use 2 different greens for our salad. We have a spring mix and we have fresh spinach. And then we're going to garnish that with our fresh pears, dried cranberries, red onions, gorgonzola cheese, and pecans.
Now, this salad, you can actually change up all of the parts, really.
Pretty much if you want to. It's very versatile, and that's one of the great things about salads is you can add anything you want to in it, and if it doesn't taste good, throw something else in.
And there's no real set rules as to what you use and what you don't. You can just add pretty much whatever you want. We're using the nuts for a little crunch. The cheese has some creaminess to it, and the berries add a nice flavor in the background. So we'll just mix our 2 greens together, and then really it's just a matter of putting on the rest of the ingredient.
Making it look pretty.
Such a delicate touch.
Mm-hmm.
Now, are these toasted pecans or are these just raw?
These are raw. You could toast them.
You know, a lot of times if you go to a restaurant and you get a salad like this, they're candied pecans.
Yes, we're using just raw pecans, and most of our recipes just incorporate raw nuts, so they don't have any added salt, any added sugar, any added fat, that kind of thing.
That's good.
And then we'll just drizzle a little bit of the dressing on.
It's too pretty to eat.
I know. It looks very nice and colorful.
I want to Instagram it.
That's it.
Yum. And there you have it. A wonderful spring salad. I'm not going to eat it because I don't want to mess it up, but it's so beautiful. If you'd like the pear and cranberry spinach salad recipe, visit watermanwellness.com. Recently, local employees took Florida Hospital Waterman's mission to improve the health and wellness of the community outside the hospital walls. Last month, employees collected food items for Agape Ministries. The week-long campaign netted more than 1,100 pounds of food, which was delivered to the organization's food closet. The campaign was part of the Waterman Outreach Home Mission Project, a new monthly initiative to help employees and their families volunteer in the community. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the May episode right here on Lake Sumter TV for some of the following stories. A local expert explains why what you eat may lead to painful kidney stones. Are you taking the right precautions to prevent skin cancer? You'll hear helpful advice from a Tavares specialist. And we'll return to the Conry Creation Health Kitchen to learn an easy egg recipe that's good for your bones. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for the award-winning Waterman Wellness.